without headset, we can hear you.
Okay, that's fine.
Over to you, because we have, it's open to others now.
Right. Assalamu alaikum, everyone. This is Yad Chaudhry, and a very good evening to all the viewers, to all of you. So, and I would like to welcome you to the webinar of ICAP's webinar on pharmaceutical and healthcare industry challenges and opportunities. So before we begin the webinar, we would like to start with the recitation of a few verses from the Holy Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Qul huwallahu ahad. Allahus samad. Lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Sadaqallahul azim. So thank you very much for being here, and there are some rules of the day that I would just like to highlight, and some of the facts. So just a couple of things in case the internet connections aren't stable, and if I get disconnected, so Mr. Khalid Noor will take over. And in case any panelist connection is unstable, I will immediately move to the next panelist to carry on, and when she joins back, I'll go back to them to continue from where they left off. And viewers can ask questions through the Q&A tab on Zoom, or comment section on Facebook Live video. We will also be conducting a poll, and this is quite interesting actually. So we will also be conducting a poll during the webinar, which will be active shortly. I request all of you on Zoom to participate in the poll. It would be quite insightful for us, and of course also for you when you would look at the questions that we would be putting up in the poll. The results will also then be shared towards the end. So let us then begin the proceedings for today. And before we begin, I would like to welcome Mr. Khalilullah Sheikh, President ICAP, after which we will then go on with the panel discussion. So Mr. Khalil, over to you, please.
Thank you, Ziad. Assalamu alaikum and very good evening to all the viewers. My gratitude to all the panelists and speakers of today's webinar. Thank you, Dr. Abdul Bari Saab, Anis Shagufta Saiba, Mr. Martin, and thank you for joining today's webinar, sparing time out of your busy schedules to enrich our participants with your views, your wisdom, and your thoughts. We also welcome all our participants to this very important webinar, and my compliments to our PIB committee led by Khalid Rahman Saab, and members like Khalid Noor Saab, Fawad Aftab Saab, Murtaza, and all members, Rauf Jan, and the ICAP team, Amber, Adnan, and all who have been working day and night behind the scenes to organize these series of webinars that we are seeing. You know, this pandemic has affected every aspect of our life, and this has brought many new normal. And the way we are conducting these professional activities is a testimony of that. And the way your institute has adapted to this change, I think it's also commendable, especially all the committees and their chair, the way they have been organizing the professional development activities. This is probably, I believe, 7th or 8th seminar this PIB committee has organized in the last 2-3 months. Similarly, other committees have been organizing webinars on very important topics like budget, where we also hosted finance minister, on economy and other matters, where we hosted state bank governor and other important government functionaries. Now, coming to today's webinar, I believe, this is one of the most important subjects. This is actually a health crisis that we are going through and we are adapting to, which has also turned into an economic crisis. But the heart of it is the health crisis. I would like to start with paying my gratitude to our healthcare professionals, our heroes, who really, have been frontline soldiers in this crisis, putting their lives at risk to save the life of their fellow citizens. So let us all pay our tribute to them. Some of them have been martyred in this crisis. They have lost their precious lives. So our feelings and thoughts are with their families as well. This pandemic while on the one hand, I mean, we have a very high regard and we continue to pay tribute to our healthcare professionals, this has also exposed the limitations of our healthcare system, which we all know that has been crippled and was under crisis even before this COVID, which had serious limitations before. And this COVID has seriously exposed it further. Every day we hear these stories of, in large big cities, of patients and their families struggling to find an ICU room, a ventilator. And what to talk about smaller cities and the rural areas. We've also been hearing about some of the overcharging by some hospitals and by some other entities. So we learn from the galaxy of the speakers today that, and we also hear from, we hear from our governments that they have been doing a great job, but we learn from our learned professionals and our speakers today that where they feel that we have done good, what they feel are the areas for us to improve, how many of these things are a reality, and what is going to be the future of this healthcare important sector. One thing is for sure, I mean, that's an opportunity in this adversity, that this crisis had brought a lot of spotlight on this very important sector. So I hope and pray that this becomes a turning point for a lot of improvements that we all have been waiting for and praying for in this sector. Also an important area that we would learn from our experts here today is how far we are from the discovery of the vaccine or the drug, the ultimate treatment of COVID-19, which is $1 million question. I mean, organizations across the globe, research organizations and pharma companies are racing to find a cure for this pandemic, which is so important for the mankind, and to bring our lives back to normal. So we learn from our learned speakers on this. And I know we have a galaxy of speakers, so I'll not take much time. Once again, a very warm welcome to you. Sit back, relax, and enjoy today's webinar. Listen to our learned speakers. Thank you, Ziad. Over to you.
Thank you, Khalil Saab. I think you rightly mentioned that this is perhaps one of the most important topics for today. And although we have been hearing quite a lot about it in the recent past, but certainly the speakers that we have today are belong to all sorts of the industry. So we have a representative from the pharmaceutical company today. We have representatives from the hospitals, and then we have a representative from the new digital platforms which are being explored in this situation and have become very, very important. So to start with, I would first like to thank pay a lot of tribute and thanks to all the learned speakers that we have for today, the panelists. And I would start by introducing each one of them a little bit so that we know, who are we going to listen to. There would be some very interesting questions, but before we do that, let's move on to the introduction. So Ms. Sharufta Hassan, she is a fellow member of ICAP, and she is also the interim CEO at Aga Khan University Hospital. So she is also an internationally acclaimed leader in healthcare management, operations, and finance. And you would be glad to know that under her leadership, Aga Khan University Health Clinical Laboratories Network became the first in Pakistan to successfully receive the accreditation by the College of American Pathologists. So this is quite a big achievement. Congratulations, Mr. Gupta. And one thing that I would also like to mention, which is perhaps quite exciting as well, that she has been recognized through several national and international awards, including the 100 Most Impactful Healthcare Leaders Award in 2019. So once again, many congratulations, Mr. Gupta, and we would be glad to listen to you in a while. Moving on, we also have Mr. Anis Ahmed today. He is also a fellow member of ICAP. And Mr. Anis, as most of you would know, he is the Chief Executive Officer of Abbott Laboratories Pakistan Limited. Previously, he has served as the Chief Financial Officer of Abbott Pakistan as well. He has over 20 years of experience in senior commercial and finance roles, where he has provided his guidance and leadership across different functions. So Anis Saab is currently the Senior Vice President of American Business Council and is also a member of Executive Management Committee of Overseas Investors Chamber of Commerce and Industry, which is OICCI. So at the same time, he has also served as the chairman of Pharma Bureau. So a very warm welcome to you, Anisab, as well. We are really looking forward to hear you speak about some of the topics which would be of great interest to the audience today. Moving on, we also have Mr. Martin Hinz, who is a German citizen, and gladly we have him with us today. He is the co-founder and CEO of HealthPass, a digital health startup backed by Germany-based financial services group Allianz. Before establishing HealthPass in 2018, Martin worked for 15 years for Allianz in the field of microinsurance. Currently, his startup focuses exclusively on the Pakistani market, and this is one of the most interesting aspects. So when I was talking to him, I specifically asked him the question that why, Pakistan? And I'm sure you all would be glad, but I will keep this as a suspense, and let's hear it directly from him as in why Pakistan, because that would be something very interesting for all of us. So, and it's certainly a privilege, Martin, to have you here today with us. Now, Mr. Abdul Bari Khan, I think the name speaks for itself. So, Dr. Bari, a very warm welcome to you here. When I was listening to his one of the interviews, so I cannot forget one statement that he repeatedly makes in one of the interviews, and I can totally relate to that as well. He says that the dream, you do not dream in your sleep. Your dreams are the real dreams are the ones which keep you awake. And I believe when you hear about the name of the Indus Hospital, where he is the CEO, so you can very well imagine that he is actually living his dream. So there's a long story behind it. There are a lot of success factors. There are a lot of things that we can learn from him, and we would be gladly waiting to hear him out. He is also serving on a lot of boards, and the most important part is that he has been awarded Hilal-e-Imtiaz in 2019. So congratulations, Dr. Bari. We are glad and we are honored to have you here with us in the panel. So looking forward to hear you in a little bit of time. So we would shortly be starting with the panel discussion. And before we do that, I would like to first maybe start the topic with talking about a little bit about the COVID. So maybe Ms. Sharufta, if you could share your views about how are you dealing with the current situation, how do you see it developing, and what are the aspects that are where you are also facing some sort of challenges?
So thank you, everyone. Thank you for having me on the panel. So COVID is an event of a century. And we've had world wars. We've had episodes where there have been outbreaks. But this pandemic is unique, is very different. And, if you read about COVID, which at least I read every day about it, is that it is being compared to the Spanish flu, which happened, a century back. As far as this disease is concerned, to date, there have been more questions about this disease than anyone across the world has been able to find answers. The disease itself has been very perplexing and very confusing for many people. And although the outbreak started in China in November, and we are sitting in the month of July, and in such a day and age, and in so many months, there is no vaccine to date, and there is no cure to date. Yes, people are trying cures, people are trying different methodologies, different medication, but there is no proper cure for this. And unless there is an antidote in the form of a vaccine, we cannot assume that this is going anywhere. And this is here to stay. The most frightening part about the disease is that it is contagious, it transmits, and in very layman term, I tell people, either you go to the virus or the virus comes to you. So it is transmission from person to person, and that's about it. As far as the pandemic itself is concerned, because of the nature, the contagious nature of this, we've seen that, I'll talk about the international world first. We've seen healthcare systems in the developed countries also being challenged. And, Pakistani healthcare system, we are part of the developing world. Of course, we have challenges in our system in this part of the world. But we've seen deaths happening in Europe, and there are countries in Europe where the death rate is close to 15%. And in US to date, you know how the numbers are increasing by the day, the deaths are increasing by the day. So it is not that it is something specific to the developing world or to Pakistan. As far as our response is concerned, so the Aga Khan University Hospital, when they started in China in November, because we are Joint Commission International accredited and College of American Pathologists accredited, and we have collaborations with the Johns Hopkins Institute, we started to do a research, and what we call is we entered into a tabletop mock drill. The purpose of this mock drill was to map the influx of the patients and what happens in case we get the patients. So we started with that, and in the month of February, when we started seeing the first patients, we actually instituted within our hospital what we call a hospital incident command system. This is a system that is used internationally by Joint Commission International accredited hospitals to respond to disasters. So we introduced this HICS command system, and we started responding. And we were the first hospital to introduce the PCR-based test. We were the first hospital to admit the COVID patient and the first hospital to treat the COVID patient. But as I said, that there has been a lot of learning, and it is important to understand that as far as the response to the disease is concerned, whether it is at the federal government level or at the provincial government level, I think our government has put in a lot of effort. And the death rate in Pakistan today is only 2%. And I just quoted the death rate in very advanced European countries at 15%. So I think we in Pakistan have done better than many others, and our governments have been there on the forefront. It is a challenging disease. It is a disease which no country in the world has been able to find a cure to. So I'll stop at this, and then maybe I answer some other questions after you talk to some other panelists. Thank you.
Right. Thank you very much, Mr. Rufta. Actually, you rightly said there is actually a race to discover treatment for COVID-19. And certainly, so far we have not heard of any, really the focused treatment. So maybe at this stage, Dr. Bari, if you could share some of your experiences, especially, with respect to the management of COVID-19 pandemic, not just in Indus Hospital, rather also across, the society in Pakistan in general.
First of all, thank you for inviting me to this other gathering, to this seminar. Actually, we were from the day one. I still remember 26th of February, the first case was reported in Karachi and Islamabad simultaneously. And I got a call in the morning at 8 a.m. from CM House that there is an emergency meeting at 9 a.m. in CM House. So we reached there, and we then started working on it. And I still remember, because there are, as Shagufta very well said, both the federal government and the provincial government responded. So we were, when first case was there in Wuhan, China. So we also started planning for that, because we knew it will come to Pakistan, maybe in a few weeks or in a month's time. And February was there when we were. So what we did, in the month of January, we had we basically converted one part of our emergency into a negative pressure area, because we knew the patient will come. Then started working on it. And I still remember that the Chief Minister of Sindh asked us, because we have to respond immediately on 27th, because we were not prepared. There was no lab, except for, as Shagufta mentioned, Al Khan started a PCR lab. So the processes of the government to procure the procurement processes in the government are too lengthy and too complex. So he requested if anyone can help us out, and then we said we can do it, and immediately 300 million rupees were released, and we were and in 1 week's time we established two hospitals, one quarantine center of 120 bed and one isolation center of 200 bed hospital. Then also at this moment there was we acquired about 20 ventilators. We started the lab at Indus Hospital. Initially, we were doing about 100 cases a day. Now, in about 3 months' time, Sindh alone is doing about 15,000 tests a day, which is and since it was a global pandemic, so there were challenges of logistics. No people there were export bans from the country. So to get one thing which you used to get in from DHL Express in 2 days. Now it used to take about 2 weeks to get. Simple. There was shortage of VTMs, there was shortage of PPEs, and and also we all knew that we from 27th of February there was a task force was created, and we met almost daily at 7 p.m. to review the last 24 hours and to plan for the next 24 hours. And then we said, as the infrastructure of healthcare in Pakistan is fragile, the only way is to control this, is to control the spread of the disease. So lockdown, strict lockdown, and because we knew it will spread, we knew people will be affected, but we wanted to slow down the spread so that there will be less pressure on the healthcare. So we managed to do that, but there was some confusion between the different provinces and different mixed messages going to the people. The social media, the role of social media, role of electronic media has been very unfortunately. So there were myths, there were conspiracy theories, and people were not accepting it. Initially, it was too very difficult to convince people that it is virus is there. So in one of the setting, I told people, we are not bothered about is it a conspiracy or not. Is it Pakistan has got now, and now we have to work together to control the spread of the disease. So I'll stop there. We can continue.
Well, thank you very much for sharing your views, and I understand since we have been hearing a lot since the past so many months. So we are also seeing a trend, as you rightly said, that basically from a level of people questioning and then this coming down in every kind of streets and all around us. And when people got to hear the first-hand accounts, so actually that also contributed to, let's say, people believing and then really taking the precautions. So, I mean, of course, the efforts of all the hospitals and the healthcare professionals which they have put in, I think these are, and also the consistent messages from them are very well were very well taken then by the people at large as well. So thank you very much, Roxa, for sharing your views. Now, of course, with the race of discovering the treatment for COVID-19 that we were just talking about a little earlier with Sharufta as well, leading pharmaceutical companies, healthcare R&D startups, the healthcare professionals and hospitals are all collaborating at global level actually to find the treatment for COVID-19. So at global level as well. And so, Mr. Anis, we have the honor to have you here with us as part of the panels, and you're representing Abbott. So please tell us about Abbott. If there are any specific products that are in pipeline for treating COVID-19 patients.
Okay. Assalamu alaikum and very good evening, everyone. And a special thanks to Khalid Saab, who invited me to join this panel. And I really feel honored to be part of it. Just before I answer what do we have in pipeline, I'll try and link your first question that you asked, Shagufta and Bari Saab, because I think that will give some perspective that from corporate level, when this thing hit us, what we were encountering and how we tried to handle it. And then I'll go to your second question. Is that okay, yeah?
Yes, sure, please. Thank you.
So as Shagufta very rightly explained the dynamics of COVID and how it impacted, and Bari Saab also further elaborated on it, I'll give you the angle of a pharmaceutical company, what we encountered and how we managed it in this unprecedented time. So this was something which happened for the first time. We didn't have the history. We didn't know how to handle it. But what was happening for the first time, and it created a different kind of environment and panic altogether. So as a company, what we had in mind and what priorities we had were basically to ensure that our employees remain safe and remain healthy, and also ensure that patients have access to the medications and there are no shortages as such in the market. Just remember that it was the time of lockdowns where markets were closed and certain areas were sealed down. At the same time, we also wanted to ensure as one of our priority that we remained engaged with healthcare professionals also and give them global perspective as to what is happening and how we should be adding value in current situation. Because it was not about the commercial part of it, but something that we thought as part of our corporate social responsibility as well. So again, I'll give you the organizational dynamics on it. So what happened that because of this lockdown, more than 50% of our organization was working from home. But we have two big plants also in Pakistan. So, and our priority was to ensure that it keeps on running and we don't create any shortages in the market. But at the same time, remember that all flights were closed and the supply chain was disrupted in a big manner. So it was the real test of our resilience. It was the real test of anticipation as to what can go wrong and what are the therapies which are required in current situation. And if I just give you an idea about the portfolio that we have, there are a lot of medication which are very essential to boost the immunity system. Just to name a few like Cervix C, Avocal, which has vitamin C, zinc sulfate, which are very, very important to really handle this COVID-like situation. Then we have antibiotics as well. So in order to ensure that our supply chain remains operative and we don't have this business continuity or the production continuity issue, our teams have started working 24/7. And I'm giving you this perspective because there are a lot of leaders who must be listening to us that how corporations are really handling the situation. One side is how government is taking different measures to handle this current situation, but at the corporate level, what companies are doing to make sure that they remain engaged with the healthcare professionals and also ensure that the supply chain remain operative at the same time. So we were in a situation where more than 50% of people are working from home, but we wanted our factories to run on full capacity, ensuring that there are no shortages. So just imagine the dilemma from employees' perspective. When they say that 50% of people are working from home, why should they be going? So creating that sense of purpose that why they are doing it requires a lot of communication, a lot of engagement, at the same time handling the environment around you. Because when you wake up and when you try to reach to office, you see that there are a lot of areas which are closed, and then you have to manage that hardship and at the same time reach to office. So that was totally a different dynamic, something that we never experienced, but something we managed very, very successfully. Not only that, we ensured that we did not have any shortages in the market, but at the same time, we ensured that our employees remain safe. They follow all the preventive measures, including social distancing, working on shifts, etc. And at the same time, when the second pillar of our priority was, how do we make sure that we remain engaged with our HCPs? Because it was also important to share with them the global perspective, what we are listening from our parent companies, what is happening globally, and how should they be really equipping themselves. And there comes a total different dynamics, so for which we thought that we were quite behind, but something which became very, very relevant for Pakistan, which was the digital space, the digital landscape, and how we use, because the challenge that we had was, one, our field force couldn't reach to the healthcare professionals. Second, patients were unable to reach to doctors as well. So how do we bridge this gap? How do we make sure that all those interfaces are connected in a very optimum manner? And we do it in a manner where when patients have access to doctors, we play a role and we ensure that they have, by even at home, they can have access to the quality doctors at the same time. So teleclinics, telemedicines, virtual detailing, you name it, and we use it in a very optimal manner. And that really created a total different kind of mindset. And that's what we call the new norm is. And the third pillar, which was again part of our priority, was how do we make sure that pharmacies, because remember that doctors are not practicing, hospitals are closed, patients are unable to reach to doctors. The only outlet they have were pharmacies. So what we did, Ziad, that using our trade or our pharmacy reps, we engaged with the pharmacists. We tried to equip them in terms of their knowledge base. We had number of webinars on the disease area, how they should be handling, because remember that Pakistan is a country where self-medication is quite rampant. So we had that thing in mind, and we thought that how should we be engaging with all those pharmacists in a very optimum manner, that we create an environment where their knowledge base is updated. So when patients walk in, at least they are aware as how to handle that. So that was a different, I would say, experience. I thought I should share it with you. In terms of the pipeline, Ziad, our portfolio is such which is very relevant for COVID-like situation. But in terms of new therapies, our focus is more towards diagnostic side of it. We are working with Barisa. We have on the molecular lab test that we are doing, and we have in Pakistan, we have supplied instruments which are across Pakistan, which has the capacity of conducting 15,000 tests a day. Then the molecular lab test that we call, then we have another antibody test that we are doing in the major cities with major labs in Pakistan, which is again creating a huge difference. Then we have lateral flow test, which is again does not require any kind of equipment, so to say, and 100,000 kits have been used by government of Sindh, and then rest is with the different part of Pakistan. So this is what we are doing. So in terms of what is in the pipeline, just to give you the global perspective, there are 65 molecules which are being tested globally at the moment. And but the major emphasis on the vaccine side of it. And what we are expecting is somewhere, and I hope, inshallah, that somewhere by end of year, we may find a solution there. This is what I'm hearing also, I'm reading also, but maybe, and I hope it becomes true as well.
Right, thank you very much, Anisab. Actually, I mean, I was very kind of interesting listening to what you were saying, because certainly I can relate to a lot of things. Also been working for another pharmaceutical company. So maybe just one thing I wanted to interrupt earlier, but then I thought I would ask you later about this on your thoughts, because you rightly shared about bridging the gap. So that's perhaps one of the most important things, and digital plays a very big role. Then you also mentioned about working from home and people finding it earlier, quite thinking that this might not be possible, but now this is actually what is working. And then the patients, when they're reaching to the doctors, that's also through online channels, and we would hear about that in a little bit from Martin as well. But prior to that, what are your views? Do you think we are prepared for the future? I mean, if any such, God forbid, future, there are such pandemics in future. So are we now prepared for that, or are we on the right path at least?
Yes, I think, Ziad, every day is a new day. If you ask me, every day you face a different challenge. And you also try and manage it in a different manner altogether. I think what's going to be relevant moving forward is the agility bit of it and the anticipation part of the businesses. How do you anticipate? How do you do the scenario building, both in terms of what can go wrong? Because, it's a lot of things which are not in your control. Just take the example of supply chain. It's nothing in your control because you're importing more than 70% of your raw material from outside, and you know what is happening at the border, what is happening with different airlines, and what is happening in terms of our own internal situation. So this is what you need to anticipate, and this thing will be developed, because what we have encountered is a situation which we never faced in the past. That has changed the mindset. Even in the organization, you'll see people working on different scenarios. We used to work in this VUCA environment, volatile, uncertain, complex, and complex, ambiguous, but this has made it even more relevant, the current situation. This has added another dynamics to it. So I think what will remain quite critical and important for organizations is the agility part, how agile you are in terms of your thinking, in terms of anticipation, and how do you make sure that not only you work as a leader, but how your team is integrated and think on the same lines and that they have the same mindset.
Jay. Bilpral, I think that's very much relevant. So thanks for sharing that. So Martin, that brings me to the digital, the innovation bit, and I know that, I mean, when I was, of course, talking to Martin earlier and also reading about Health Pass, so it looked very interesting to me. So I mean, maybe Martin, if you could share, the innovative proposition that you have for the patients in Pakistan, and specifically, it would be great to know the details and the motivation behind. And also, I would link it up with that I mentioned in my opening message, that why Pakistan and what's the proposition behind?
Okay, sure. Thanks, Mehabani, for the invitation. I would say that Health Pass is certainly the smallest and the youngest organization here, so it's an honor to be standing next to such renowned brands as Indus, Aga Khan, and Abbott. May Germany say whom? But I just arrived in Islamabad this morning after international flights has been possible, so it's good to be back on ground where the action really happens. So I'm now calling in from Islamabad. Also from my side to the audience, just a little reminder on the voting. There's one question on Teledoc in the voting that we would like to share later the results of, so please vote as much as you can. Now, in terms of the business model and the motivation, so let's tackle the business model first. So there's several online doctor services in Pakistan that already exist. So I'm not claiming the innovator who brought it to Pakistan. There were people who did this earlier. And still, although there are several companies, including Health Pass, the service itself is still quite little known. The awareness that you can just grab the phone, talk to a doctor, get an e-prescription, that still strikes people as something super novel. So I think this is why the question came, Ziad, can you please introduce? Because an Indus hospital and Aga Khan and an Abbott doesn't need much introduction because people already know what this is about. So I was even given the chance to share some screenshots so that every one of the participants and even the panelists can imagine just how does it look like if you talk to a doctor online. So I hope that this will work. When I share my screen, just give you a little view of this. So it's an app-based service, and there are several such apps, as I mentioned, so Health Pass is not the only one. And then you can talk to a general practitioner, you see by the photo, you see by the availability, by the price point, and then you choose. You can also see the qualifications, and then you pick one doctor. In this case, I was picking my colleague, Dr. Maria Khan. You see her there very engaged, talking to myself the other day. And then she was giving me, I must say this is a test prescription because I was fortunately not really, really sick. And she also got my age and my weight wrong. So, so don't take that as the real values. But anyway, the idea here is that you get a doctor's report afterwards, which also contains a prescription. It has the PMDC number of the doctor. So it's a legally valid document you can take to a pharmacy to fulfill, or to a lab to fulfill what the doctor has recommended. And that's as simple as it is. It takes like 15 minutes. There's no waiting time. You don't have to travel. And around 80% of the cases that we can get resolved on first call. Because initially people were asking, well, but how about the physical element? Doesn't the doctor need to touch me or look into my mouth? And that is certainly true, but for 80% of the cases, it can still be dealt with without this. And then 20% are referred to a specialist. Because you can also choose here, not a general practitioner, there's also dermatologists, there's urologists, so many specialties that you can choose from. So you have it all there at your fingertips. Oh, that's my email in case anyone wants to get in touch with me. Medicount is the legal name of the entity. Health Pass is the brand. So this is really how it looks like. So I think that experiment with the screen sharing worked really, really well. So thanks to Zoom in this regard to make this also very, very possible for us to interact and be sort of interactive here. So what Corona and the COVID crisis has done to us is it has tripled the number of calls. So we are now handling around 3,000 calls a month. Prior to that, it was around 1,000. If you compare the pricing of this business model, it's in many cases much more affordable than going to a doctor, because a GP call, and that's more a market rate, it's not us, but you get a GP call maybe for between 150 and 250 rupees, and a specialist, the average ranges around 1,000 rupees, and you can pick and choose because it's all there, like a menu in a restaurant where you choose what you like best. And of course, you don't have the travel times, there's no travel costs, you don't have the waiting times because the doctors have to be there. They can't keep you waiting on an online appointment, and it's available 24/7. And in COVID times, we also saw sometimes when everything else is closed, the OPD wards of many hospitals were closed. It's the only way how to get care. So this is a little bit the business model and how it sort of grew, and how COVID has been a catalyst to the growth of digital online health. Now you were asking about the motivation, and I'll keep the part about Pakistan for last here. So the more general motivation of Health Pass is to improving health by digitizing health. Yeah, and our investor, our backer, our sponsor, Allianz, the financial group from Germany, very much shares this. So we have this aligned vision, and then you see the benefits that telemedicine creates for people with limited mobility. Is it because of lockdown, or because they're elderly, because they're women who are sort of restricted socially from moving about? It's also very, very helpful. We have seen for taboo issues where people actually prefer the anonymity. You can also switch off the video. You can even put a fake name if you like. And it's also good for people who are just pressed for time and say, look, rather than now calling up a doctor waiting for him to show up, you can just book an online appointment. You can do this anytime. So, and why Pakistan? Okay, so simply put, Pakistan is the ideal market for telehealth for a startup like us. It has a very large population. It has the various health infrastructure challenges, which were already mentioned, for example, by Shafqutta and others. And it has the largest potential for disruption and the biggest impact, just because it's there's still so much to do here. Rather than going to a developed market where you just improve things incrementally, I think here it's more time of a digital revolution. So this is why we got very much attracted by Pakistan, and this is why we're focusing on Pakistan.
Great. So at the same time, while it's bridging the gap in the real sense, it's also perhaps enhancing the access. And so thanks, Martin, for sharing the insights. So when we talk about the access, of course, that naturally takes me to the to then also the Indus Hospital. And so, Dr. Bari, if you could share the facilities that are available at the Indus Hospital, and specifically for the COVID-19 pandemic. Also, if you could tell us more about the operating model of Indus Hospital. So we would be gladly listening to that.
I'll briefly share the journey of Indus Hospital with you all. Basically, I was trained in the public sector hospital that I graduated from Dar Medical College. Attached to is the Civil Hospital Karachi, which is a public sector hospital where doctor and beds were available. The rest a patient had to bring from out of pocket. So every patient had their stories. Someone selling their cows, someone selling their goats, their house belongings to get simple hernia repair surgery. So we were brought up in that environment. So we could see many hundreds of people, parents saying, let the patient die. So we started an organization by the name of Patients Welfare Association. Up till 1981, the source of blood was professional donors who used to sell their blood, drug addicts. Once or twice a week, they have everything in their blood except blood, that is hepatitis, HIV. And in 1986, I graduated from that medical college. And in 1986, people may remember there was a bomb blast in downtown of Karachi, Buri Bazaar, where we lost many patients. So the emergency department is a bad shape. So we decided to rebuild the emergency department. And then I graduated, I did my fellowship in cardiac surgery, came back and appointed the assistant professor of cardiac surgery in Dow Medical College, established the cardiac surgery ward there, and did offered cardiac surgery free of cost. In 2005, the dream of Fitness Hospital was realized, and in 2007 we started as a 150-bedded hospital, and the aim was to provide quality care free of cost. So the model was, so it's a totally cashless hospital. It is totally paperless hospital, cashless to an extent. There is no cash counter. So everything is free of cost. People were very skeptical that a model running free of cost, it is not possible. People gave me a month, 6 months, max a year that we will be starting charging people. About now, we are about 12-year-old. We started with 150-bedded hospital. Now we have 12 hospitals across Pakistan, and we have 100 and we are present in 51 districts of Pakistan in public health programs. So our first year budget was $1 million. Now this year it is $150 million. So not a single patient has been refused treatment because of lack of money. And we are proud to be a Pakistani because 92% of this revenue is generated from within Pakistan. Coming back to the COVID facility, which we have all facilities except for neurosciences and adult oncology. For COVID, we have now the largest PCR lab, molecular lab, and we are doing about more than 2,000 tests a day. So then we have a COVID unit, which was about 60 bedded, and it will be increased to 100 bed by the end of next week, inshallah. So, and apart from that, we have been training people in different capacity, building capacity of public sector hospitals also. We have been instrumental in establishing labs in Jinnah Hospital, upgrading in also in interiors of Sindh. So together, the other good thing which came out of this crisis has been the collaboration between the private sector, the public sector, and the not-for-profit sector. So we set from day one, Dr. Faisal Mahmood, the ID expert from Aga Khan Hospital, sits with me in the Prime Minister, Chief Minister Task Force. So I think so, as people say, from crisis you have opportunities. So there are collaborations, training people with now we have created one Sindh Critical Care Initiative, which is a tripartite agreement between Government of Sindh, Indus Hospital, and Aga Khan University Hospital. So the model is there. We are increasing the capacities of ICUs in public sector hospital. Example is 140-bedded HDU developed in Expo Center, where the Aga Khan and Indus Hospital are working together, training people. And this has apart from this, the tele ICUs and telemedicine and the Zoom meetings. The world is changed now. It will be different. The healthcare will be different. We have to be prepared for that.
Right. Thank you very much. And I think, I mean, this is perhaps, the way of moving forward, like public-private partnerships that you mentioned, because of course you see a lot of success. You hear a lot of success stories about these models. Initially, of course, there were quite a number of questions around it, but as you rightly, of course, said that once it started, so the outcomes were so good that this is developing at a fast pace. And maybe, I mean, Shagufta, if you would like to highlight some of the points with respect to the role of, because of course the role of the private hospitals is perhaps very important in the entire the healthcare channel. And when it comes to about enhancing the access, I know Aga Khan is also doing quite a lot, and at the same time by maintaining the quality. So that's one of the key important factors. So any specific, I mean, first, if you would like to comment on that, and secondly, if there are any specific challenges that you see along the way, along this journey.
with COVID and with healthcare, I think the one thing which is very, very essential is quality. Because if quality is compromised, I'll give you a small example of a diagnostic report. And if a wrong diagnosis leads to a wrong treatment, and a wrong treatment results in healthcare loss, financial loss, and mental trauma. So quality in healthcare is extremely essential. And since day one, we have at the Aga Khan Hospital, we work, no matter what we do, whether it is COVID or anything else, we have 4 guiding principles: impact, quality, relevance, and access. And these are the 4 guiding principles on which we work. So as far as COVID is concerned, because of the nature of the disease, what we've done is that to create access, it was very important. As I said, it is a very contagious disease. We have kept COVID patients in a very separate, isolated building, where these patients who are with COVID have no way of co-mingling with any other patient. So that's the first thing that we have done as far as where treatment is concerned. And we've dedicated our old private wing for this purpose. So it's a private wing facility, which Aga Khan, due to the nature of the pandemic, has put for the COVID patients. In the emergency department where our patients come, again, we have a separate dedicated respiratory care unit where COVID patients are taken care of as far as the emergency is concerned. The third thing that is important to note is that the testing of these patients, a dedicated testing site has been created in our football field, because we are a university as well. So in our football field, there's a dedicated testing site that has been created, so that the primary thing, as I said, is these patients, because of the transmission of this disease from one patient to the other, are not mixed with the other patients. But one thing which is very important, I think we have a very interesting platform, is the collateral damage that COVID is doing. Internationally, we see, you look at US, you look at any other part of the world, people with heart attacks are not coming to hospitals. They are preferring to die at home than to come to hospitals. That's the sad bit of it. So it is important for people to understand that, yes, COVID is there, but facilities where proper segregation is done, then there is no fear of COVID. It is, the consensus across the world is what they call universal masking. So if there's a mask that you wear, that's the biggest prevention, and that's the biggest precaution as far as COVID is concerned. And anywhere that you go, I'm using this platform for everybody. Please ensure that social distancing is there and a mask is there. This is the biggest defense that any of us can have against this disease. These are very simple precautions, but they will go a very, very long way. At Aga Khan, what we've also done is that all our facilities are now restored. So our clinics are resuming, everything is resuming. But post-COVID or during COVID, what we will all see is that the way healthcare is delivered will change completely. We've already, what Martin just showed, we've been doing teleclinics since the commencement of the disease. 28 specialties offer teleclinics. We've started home services. We've started electronic services, home delivery of lab samples we take home, pharmacy we take home. So what we are trying to do is that if those patients who cannot come to us, we are taking healthcare to their doorstep. Like Anis was saying, that it is important. See, the need has not gone. People have not stopped getting sick. It's just that the fear factor is there. And it is very important that the fear is, we are able to allay the fear. And the way that this is going to happen is that practice safety. So at our campus, for example, any of you come to the hospital, you will not be allowed inside the hospital without a mask. There are people sitting with a sanitizer. They give you a sanitizer to enter. So what we're trying to do is ensure that safety is being practiced, because, you know, on the vaccine front, Anis, I was in a seminar that was arranged by Bill and Melinda Gates Foundation around 3 weeks back. And according to the BMGF seminar that I attended, and it was along with the University of Washington, so 2 institutions had organized it jointly along with Aga Khan University Hospital. And according to them, and Anis, I hope what they said was wrong and what you said is correct, because according to them, the vaccine is not coming for the public until 2023. For the public. They said, if we are lucky, the vaccine for the healthcare professionals will arrive somewhere at the end of 2021 for the healthcare professionals. So COVID is here to stay, and we all have to figure our lives around COVID. And if there are safety precautions, as I said, we all have to practice that. Thank you.
Well, thank you, Sharufta. I think this last point that you mentioned, so I'm still thinking about it, and we would certainly be coming to that. So, and I guess, I mean, this is the need of the hour, actually, is to exercise the precautions and safety, and not just for ourselves, also for the people around us. So that's extremely important. So,
you know, can I tell, you know, the one thing that I have to say here is that, you know, even in the hospital, it is very difficult to wear a mask. Even a simple surgical mask, leave aside what the doctors have to wear and the healthcare professionals have to wear. But, and people somehow think that what difference does it make? But that one thing makes all the difference. The social distance makes all the distance. So it's very important that we understand this. As I said, there is no cure and there is no vaccine. Prevention is the only way forward in this. So it is very important that we all practice that. Thank you.
No, thank you very much for highlighting that. Actually, that's an extremely important point, which I believe should be, repeated as many times as possible, certainly. Anisa, so the pharmaceutical industry or the companies, the pharmaceutical companies are also playing an extremely important role, and but there are, of course, together with some of the opportunities, there are also some challenges. So maybe since you have also represented the Pharma Bureau, and you are also the member of the OICCI, so we would like to hear from you as in some of the challenges that the pharmaceutical industry is facing.
Yeah, so Zayad, there are a lot of challenges, but I think I'll focus on the key one. You see the environment in which we are in, you see how exchange is moving, how we are living in that high inflationary environment, high utility costs. And if in that environment, if you try to control prices, even for the food supplement, etc., and you regulate, and if you try and over-regulate this element, this will not going to help and flourish this pharma industry. So this has been a big challenge for the pharmaceutical companies. We have seen a lot of MNCs exiting from Pakistan because of the pricing and regulatory challenges. One of the challenge that if they like to bring in new products, it takes a very long period of time to bring in new products. And second, by the time they bring in new product, you will see exchange, what was assumed at one point in time goes to another level. And whatever happens to your input costs, you don't get any adjustment, not even a slightest portion of it. So this results in two kind of dynamics. One, that you see shortages of medicines in Pakistan, because if a product is not viable, companies do not then produce those products. And what happens at the end of the day, that patients end up paying 10 times for the price of the similar products, which is coming through the gray channel. So what is happening, that not only that it is impacting the exchequers, but also impacting the industry as well, because had they been given the right of adjustment in terms of pricing, product would have been available. Not only that, they would have invested in their infrastructure as well. If you look around countries like Bangladesh, India, you'll find a lot of FDA approved plants. Why it is not happening in Pakistan? Why our export potential is too low? Because there is no predictability in terms of our policies. and there is no certainty in terms of what we should be doing moving forward. So how do investors plan their long-term investment if they're not sure about what is going to happen? And that uncertainty, that ambiguity, and that ad hocism is something which has really impacted this industry a lot. This is the industry, by the way, from McKinsey's survey and their study point of view. They have highlighted this industry as the sunrise industry. Just imagine that this industry is worth $3 billion, which is again have huge growth potential. And if you look at the volumes of the industry that this country is producing, and if you just multiply that by the average or even the 50% of the price that you see around us, you'll see the market would have been totally different what you see today. So that's the biggest challenge, these regulatory, and until and unless Ziad, we become in line with what the overall global regulatory environment is, practices are, this industry will keep on struggling. And at the end of the day, it's patient who suffers.
So, Anisa, you mentioned about the FDA approval, and for that, of course, the investment is needed, for which, you mentioned about some of the challenges where if these are resolved, then certainly the companies can invest more in the infrastructure, which can also then make the FDA approvals and the WHO certifications possible. So I know you mentioned about the export potential, but how big is that? Do you really see, how big a potential do you see in terms of exports if the challenges are addressed?
Yeah, that I just share with you what McKinsey did in 2010. And at that time, they mentioned that there are certain elements which are regulated. And if those become deregulated, our exports could go to a level of $1 billion, which is at the moment is less than $200 million. Less than $200 million in Pakistan. And if you look at India, they're more than $20 billion. And if you look at in terms of the price control, they have only 348 molecules which are price controlled. We're not saying that they should be deregulating everything, but there are certain elements of which should be then deregulated. Even if you look at Bangladesh, what is happening there, in India, and how their industry is growing, look at their export, which is more than 10 times that what we're doing. And we have the capability, we have the infrastructure, we have the human resource available. We have seen what MNCs have done in terms of the tech transfer to local companies. And if we just optimize in terms of the right policies in place, and this is what has been the discussion with the government as well, that if you keep on keeping the pricing with the regulator, it's not going to support the industry. So it has to be somebody independent who has this long-term view in terms of what should be the policies moving forward.
Right. So thank you very much, and let's also see some of the global. Let's also hear about some of the global perspectives to it. So, Martin, if you would like to share some of the insights on how the pharmaceutical industry or the sector is. The key differences. I'm sure you must have done your research as well, right? So, the key differences that you see between how is it in other countries, for example, in Europe, and how is it in Pakistan? What are the key differences that you see?
Oh, that's a tricky question. Actually, I would say I'm not an expert on health system comparison in that sense. I think the only thing where I do see a difference is in the education level of people. So when it comes to sort of and trust level in what the government is doing. So I think in Europe, generally, let's say the education level is slightly higher. So people know what to put away as sort of fake news, but it's still, it's not perfect. I'm just saying it's maybe easier for them to listen to what's the real precautionary measures, which are exactly what Chef Gupta was saying, and put faith in the government to manage it. So I see there probably a higher trust level and a higher compliance level due to higher education. But I stop here. I really can't say much more than that.
So I think G. Barisa.
Ziad, I want to just interject into it. Basically, Anis Saab has highlighted a major problem. So I sit in the policy board of the DRAP, Drug Regulatory Authority, and also in the Prime Minister Health Task Force. It's a nightmare because we have been trying to resolve these issues which Anis Saab has risen. Because we we agreed that there should be a third party who should be regulating the prices, not the ministry or the draft regulator. There is the conflict of interest, and we have proposed. There is a draft act, new act, new acts. Unfortunately, but the processes, the systems in the bureaucratic systems and the political systems and basically the court systems. It is a nightmare to get all these things. We all agree with Anisa, and if Anisa will read the new act, all these his concerns are taken care of. But it's almost more than a year and a half. I have been telling people, I am telling them I have to resign from these posts because if we cannot make any difference. But then people will say, try on, keep trying. One day we will succeed, inshallah, to get resolve the concerns of the pharmaceutical industry.
With you being in the board, Barisa, we are still hopeful. So I'm sure that you have to remain there. At least we see some light at the end of the tunnel with you being around.
Yeah, thank you, Barisa, for all your support as well. And I think these are some very interesting and crucial points which have been made around here. So also, Martin, I mean, thanks for your views on that. But of course, we were also we were kind of more referring towards the regulatory environment. But since you have mentioned about about the general society at large, so I might as well ask you about some of the elements, and we are also seeing some interest around the topics of how to bridge this gap and approach the doctors via the digital channels. So there's whenever you talk about these topics, there's also a question about the data privacy. So how do you I mean, we would also be interested to know as in how do you maintain that data privacy, and how do you manage to maintain to adhere to all of the principles which are there. So
Okay, good. I'm very happy that you float this question, because data privacy is usually one of the first things that fall off the cliff in discussions. So thanks for putting a spotlight on it, because I couldn't agree more that this, wherever health data is concerned, and in our case, we also have financial data of our customers. So it's like a double data privacy and security challenge. That is paramount that this is protected. So what we do at HealthPass is we follow this mantra, which I think is a general one that companies can follow, is that we treat customer data like you would like your bank to treat your savings. That's an analogy which is, I think, quite helpful, because when you carry your money to the bank, you want it to be secure, like you want your data to be secure. You don't want others to see how much money you have in the bank, because that's confidential. You also want to be able to withdraw your money or your data and carry it somewhere else if you want to shift it. And most of all, I think the money is owned by you, not by the bank. Same as we believe that the data is being owned by the patient and never by the company who manages it, whether it's HealthPass or any other company. So this is sort of the analogy we often use to make clear to everyone, to our employees, to our partners, look, data privacy, that is like savings. Treat it very, very, very carefully. Now there's two aspects to data privacy, just to segregate this a bit. One is really what you call data privacy, which is the legal side of things, which is sort of principle-based. What rights do I have? And the other thing is data security, which means how secure, how safe, how warded and ring-fenced is my data in your systems. So I think the answer, what HealthPass does in data privacy is rather simple. We are EU GDPR compliant, which is the general directive on data protection in the EU. And that is currently considered the gold standard worldwide. So while it's not compulsory in Pakistan to do that, we have done that. And in terms of data security, so really making sure that no hacker can access it, we're actually inviting hackers to hack us. You call this a friendly hack. And we have done this a couple of times. Of course, then they share their results and they say, look, we've been able to penetrate as much of your firewall as this. So, and then we fix it. And the benefit of doing this, we have seen in March when we had a bad hack, actually a cyber attack So our service was down for 3 days. But the good thing is no sensitive data was leaked. So it was good that we had these precautionary measures to protect our data even when we are under attack. So that's what I can say to data privacy and data security. It's super important. We were talking about a lot about precautionary measures, and I think my story has illustrated this is important in data protection and data privacy as well.
Right, so that's good to know. Actually, while we are talking about it, the viewers would also like to know as in how they can benefit from Health Pass. If you can very briefly just, yeah.
Okay. I think for individuals, like individual viewers, I think we have already covered this. This is mostly in the area of convenience, of affordability, and in terms of quality, yeah, that you can benefit if you use telemedicine in many, many situations. Not in all, but as I said, in 80% of the cases, it really already solves the case. But I also understand that this is ICAP, and there's a lot of chartered accountants in the question and answers. I was seeing this question, why is this relevant to chartered accountants? So let me focus more on the corporate aspect of it, since I assume many of you are decision makers and on the financial side. And telemedicine, if it's given to employees, as an employee benefit, that can really benefit the organization as well in terms of cost savings, because your IP admissions go down, so your insurance premium goes down, because people get treated earlier. It also leads to a higher staff morale, which increases productivity. So in that sense, I think it's a good complementary tool. And if you see at the affordability of it, what's the cost? You go to the market, as I said, there's several players, and you pay around 1,000 rupees per year for unlimited teledoc access to GPs for you and your family. So it's like a flat rate for a year, and it's 1,000 rupees. If you compare this to how much you pay on insurance premium just for hospitalization, you see where the cost savings can be coming from. So that is a benefit, let's say, more on the corporate side. And if you use teledoc also as a gatekeeper, then the cost savings even increase. If you say, look, before you even go to hospital, make sure you call a doctor first. It just takes 15 minutes. It's not a big effort for you, but talk to the doctor first and see if you really need to go.
Right. All right. So basically, so insurance is one of the topics that you mentioned as well, right? And I mean, certainly this is going to bring down some costs as well, but also at the same time, we also see quite less number of people having the medical insurance, and that's also one of the areas where I believe we perhaps need to improve, and that would also enhance the access in return, certainly. So. Yeah.
So, can we see the voting, by the way? Because I said, please vote. And the last question of the 10 was how many companies are actually thinking about doing teledoc or might have even already implemented it. If the moderators could show maybe those results, that we see how the voting was going. Is that possible?
Yeah, we'll shortly be sharing that. But since we were talking about the insurance, I would also like to refer to Ms. Sharufta, because I believe she has a lot of experience working with the insurance company. So let's hear from her. How do you see this developing in Pakistan?
So, Ziad, I have tried to work on health insurance through insurance companies several times. The problem in Pakistan is, and where the camel's back breaks, is the anti-selection, because people procure health insurance only if they know they have to get a total knee replacement done or they have a job to be done that year. So I think the way and the reason for the corporate health insurance working is that they have larger group sizes. So my thing is that the government has to make these efforts to bring micro health insurance, and the insurance companies have to work on individual healthcare insurance. There are countries in the world, and I'll give you the example of Kenya. In Kenya, 88% of the population is insured. So this model of health insurance is doable, and I will be very delighted to work with an insurance company on health insurance, because when people get sick, people don't save for health. The habit of saving for healthcare is not there. So the model that I have in mind is that we have to work towards healthcare saving. And it has to be a saving come insurance product where people are saving and that becomes part of the premium. Pakistan is a very large company. You were asking Martin, why Pakistan? And Ziad, my question to you is, why not Pakistan? Pakistan has a huge potential. It's a very large market. 220 million people is a very sizable market. And therefore, if we are able to combine saving with insurance, I think that should be the way forward. And the more people are included in this and this anti-selection element is undone with, I think the health insurance would work. Because what we see happening at the hospital is that, a heart attack is not planned. And when it happens, people have absolutely no saving. And therefore, it is important that saving and insurance are combined. So whoever are the people here on the panel or the participants from these two industries, I think if anybody wants to work with me, I'll be very happy to work with you on combining saving and insurance together. Because what the pandemic has taught, all of us, is that, it's not about oil. It's not about land. If there is no health, there is no economy. Therefore, health industry or spending on health has to be fundamental, and insurance in healthcare will play a very, very major role. So that's the thing, that's in my opinion, how it could work successfully.
Right. Thank you very much for sharing your views, Mr. Rufta. Actually, just to maybe also clarify, my question, as in why Pakistan, was, when I was looking at the model earlier, so it was certainly something which was a no-brainer, that sixth largest population in the world, increasing opportunities to enhance access, and actually we see infrastructure and everything developing in that direction. But my question was why Pakistan was mostly from the digital point of view. Like, the digital channels that we have, these are somewhat still in a developing phase. So that's what, and yeah.
There's a PwC health report that I was reading, which they did a survey in the US on telehealth. And when they asked the customers, would they be willing to shift to a telehealth platform? This is US, this is not Pakistan. 67% of the participants responded that yes, we would like to switch. But when they asked, have you switched to a telehealth platform? Only 10% had switched. So there is, what we say and what we actually do, there's a difference.
Exactly, and thank you very much for pointing that out, because these kind of surveys actually tell you the real, how it is developing. And this was exactly the reason why I was asking that, because perhaps, I couldn't find any survey, any such survey for Pakistan. Maybe Martin can give us some insights, but I would assume that still, we are kind of a little bit developing there. But this pandemic actually has, made people experience a lot of such channels, and actually people are, at the same time, they are getting a lot of benefit from it as well. So thanks very much for sharing your views on that. When we talk about certainly the access, enhancing access, and bridging the gap, at the same time, availability of medicines is extremely important. And in certain times of uncertainty, of course, it's even more important that the medicines are available. So Anis Saab, you also mentioned when you were talking earlier that when you were sharing your views earlier, so you also mentioned that the two most important things for you, so one was the safety of the people, of the employees, and then at the same time to ensure that the availability of the medicines in the market. So that brings me to thinking that basically, when I look at the overall pharmaceutical industry scenario, there are quite a number of companies. There's a heavy dependence on sourcing the APIs from India and China, and I mean, in recent past, we have also seen some escalation of tensions with India, and some difficulties in importing these APIs as well. So, how do you see this challenge? And how do, I mean, especially the vulnerable, in times of if there is an escalation. So, how do you see this developing, and do you see the companies moving to other sources, or exploring some other opportunities for sourcing the APIs?
Yeah, I think it's a very good question, Ziad, and especially in current situation, looking at the geopolitical situation that you're seeing and how Pakistan has been addressing this issue in the past. It's been very unfortunate, not only for pharma industry, Ziad, but for other industries as well, that we have seen very less backward integration or really work on basic manufacturing, so to say. And if you ask me, the reliance on active ingredients from China and India is very high. If I just give you an example of local or of our pharmaceutical industry, and its reliance on India is close to 60%. So, and pharma is, and you've been part of pharma industry yourself, so you can imagine that you cannot change your vendors so quickly because you go through the stability, you have to do all kind of stuff. And that's one element. Plus the other sourcing, especially in Pakistan, like environment when things are so controlled and regulated, that may not become commercially viable as well if you go to other sourcing as well. So I think and Bari Saab is here, and I would like to request him also to encourage government to create something and create an environment where investment come in the basic manufacturing side of it for two reasons. What we are seeing is happening around us from geopolitical perspective. That's number one. And second is from our foreign exchange point of view. If we are doing something for basic manufacturing, not only that you'll be creating jobs, you'll have less dependent and reliance on countries outside Pakistan. And what we have experienced in COVID situation is that when channels are blocked, when your supply chain is disrupted, and at the same time you face what you're facing at the borders, not only between us and our neighbor, but what is happening with China and India, that is going to create a real disruption for the entire generics market for globally as well. Because what is happening in India, that there are a lot of shipments which are coming from China to India, they are not being released, and that will have an impact on the overall APIs which are going to be supplied globally as well. So I think as a policy for Pakistan, they should be working towards basic manufacturing for pharmaceuticals and also other industries, because that's going to be the name of the game. And because what we have learned in COVID situation is that's the biggest element that we are importing, and we are spending a lot of foreign exchange behind it. So one, to secure that risk; second, to reduce that dependency; and third, to create jobs. I think that would be the key thing for us to move on.
Right. Thank you very much, Anisa, for sharing your views. Actually, this is one of the, let's say, a very important topic that needs to be addressed, certainly, in order to ensure sustainability of and availability of the medicines in all sorts of challenging times that we might face. So I would be moving towards the questions. We have been receiving quite a number of questions from the participants, and I would be coming back on this topic in a little bit after asking a question from Ms. Sharufta, since she unfortunately has to leave a little earlier. So I mean, there is a question which is specifically related to the laboratories, and I mean, if I may ask, so the question is coming in from one of the participants, Mr. Zahid Chaudhry, and he asks: is our laboratories are well equipped as of advanced countries? Also, why the results from one laboratory is positive and in second is negative, and so on. So specific with respect to the COVID-19, and maybe it would be great to hear you tell us more about it, Mr. Rufta.
Look, I started when you asked me the first question, I talked about quality.
Yeah.
And when I talk to people, for a layman, a lab report is a piece of paper which has some alphabets and some numbers. And what processes are done at the back to come to that is not visible to the customer or the patient. And people work based on trust. And when the question is, are the labs equal to international standards? As far as the menu is concerned, how many tests do we offer in Pakistan? So if we compare to the Mayo lab or the larger labs, the SRL labs, the Mayo labs of the world, those labs perform close to 10, 11,000 tests. So their numbers are much higher. Some tests even perform 15,000 tests. But in Pakistan, as far as labs are concerned and as far as the needs of diagnostics are concerned, yes, there are labs that our needs are met. From Aga Khan, let me tell you, there is only to the extent of 12 to 15 tests, which are very rare tests, genetic tests, very, very rare tests that are sent to us, which we have to sometimes send outside. So yes, as far as the menu is concerned, we are there. But on quality front, I mentioned the College of American Pathologists, you said that. It is very important to know what a standard or an accreditation means. So the test is that if you get a report from a ICAP accredited lab and the lab report of any other lab in the world that is ICAP accredited, the accuracy of those reports is in the range of 99%. So if somebody's report is 100, there will be only 1 percentile difference, not more. And to get to that, for every test, you will be surprised to hear what I'm going to tell you now. There are over 3,000 checks and standards that are applied for every single test. That's the CAP requirement. And when the question comes, why is one report positive and one report negative? As far as COVID is concerned, I will talk about the various tests. So the antibody test, the antibody develops in the system post the 8th to 10th day. So if somebody is comparing the antibody test result with the PCR test, those two reports, depending on the day the virus has entered the body, will be different. But when you compare two PCR reports, the PCR test report is 85% accurate, which means that as soon as you come in contact and the virus enters your body, it is the gold standard result, which means that within hours of contracting with the virus, the test result becomes positive. However, in some people, the virus takes longer to show on a report. But, when some people say some test report is positive and negative, what happens at the back end in the lab has to be seen. I do not wish to comment on what happens in the other labs, but I said that for us, it is important that we follow the complete drill of all standards. And this accreditation, we are the only lab in Pakistan to have it. That shows how difficult it is to earn that accreditation. So it is a very difficult thing, and 70% of treatments are based on lab results. So again, a wrong diagnostic can cause a lot of disaster to a human. So I don't want to comment on one test report, positive, negative. I gave you the scientific reason, but I do not wish to comment on the quality of the various reports that are coming out. Thank you.
Very much for the insights. Actually, it was quite helpful in understanding some of the reasons behind it. I believe it fully answers the question as well, fully addresses the question as well. So I know, unfortunately, you have to leave, but thank you very much for joining us. And of course, adding a lot of new insights and your views to the discussion today.
I'm extremely sorry that I have to. There was something very urgent, pressing that came, due to which I have to sign out. I thank you. Thank you, Ziad, and to the ICAP for having me on the panel. And I wish everyone a very restful weekend. Thank you.
Shagufta, before you leave, I would like to extend our deepest gratitude to you for being with us today. We are very, very proud of you, heading a very, very important position as a chartered accountant and a female chartered accountant. I think you have been a major asset to the profession, and we are extremely grateful for your presence today. I will extend my thanks to others. Since you were leaving, I thought that only appropriate to come in now and say a big thank you. And I fully agree with your views on insurance. And I think going forward for health protection, this is the only way out, because the way our people suffer, I think the state has its limitations, and people have to support their own health and save for their own health. So thank you very much for being with us today, and have a very good evening, and have a very good board meeting. Thank you very much.
Thank you so much. Thank you. Thank you. And Allah Hafiz. Allah Hafiz.
Allah
Thank
Hafiz.
you. Thank you, Khalid Rahman Saab, for your comments as well. Thank you very much. Before we move to the next questions, there are a lot of participants today who are chartered accountants and working for. Basically, there's a trend, since we are talking about the digital age. So a lot of the chartered accountants actually have gone through a lot of paper trail being maintained in the organizations, and everything going through paper. And then we saw transition. We saw transition to the paperless environment, and still a lot of the entities are transitioning towards there. In the same way as digital was kind of seen rather differently earlier. So still there are some change management challenges with respect to the going completely paperless. But it would be very, I think, pleasantly. It was very pleasant for me to know that the Indus Hospital has a completely paperless environment, and we would really like to hear, Dr. Bari, from you, as in how were you able to achieve this? Because this is something very interesting for all of us, actually.
Actually, from the day one, when we were making the hospital, it was the decision that we will be paperless. So the first hiring was software engineers, and they sat with the doctors and asked for their requirements. And it is it is an honor for us also, because it is totally indigenously made software. We have not bought it from the out of shelf or from other companies. So they own it. Though the doctors own it, so they use it. So that's why from day one. So about the telemedicine, we have been using the tele ICU. In 2007, there was a consultant Pakistani intensivist in Long Island. He used to do round daily from Long Island. It was the first transatlantic ICU, tele ICU. So that's why, because the people working in our hospital had no other option, just to either our way or highway.
Correct. Well, that's great. While we are talking about, of course, the Indus Hospital, so there is also, it naturally brings me to a question, as in, what support do you need, or the Indus Hospital needs from the public sector, private sector, and the individuals?
It's basically, as I told you, it is totally dependent on the contribution from the society. So we need funds. That's not only for maintaining it, because as I told you, it is $150 million annual operational expense, but we are expanding. We are expanding because we are at this moment, we are a 300 bedded hospital, but we will be, inshallah, will be 1200 bedded hospital by 2022. We would have been there by 2021, but this COVID has pushed us another 6 months. So Another 600-bedded hospital is being established in Lahore. And hopefully, by the end of this year or first quarter of next year, we'll be starting 200 beds in Lahore also. So it's a contribution. And I'm proud to be a Pakistani because Pakistan nation is one of the first three nations in giving. So as I told you, 92% is raised from within Pakistan. So do we have a charity registered outside also? But when I go abroad for fundraisers in US and UK, I said you hear a lot of bad news from Pakistan, but I have a good news from Pakistan that 92% of our funds are raised from within Pakistan.
Yeah. Actually, I heard about that in one of your interviews, and it was surprising at first, I mean, frankly. But then when I really thought about how we are as a nation, so that's something which we are really proud of, actually, and that tells that is reflected in the results. Plus, if I'm not wrong, so I think last year's operational budget was 15 billion rupees.
Yeah, 17 billion rupees.
17 billion.
17 billion rupees.
Yeah, 17 billion rupees, right? So if 92% of that is being generated from Pakistan, that really says a lot about what we are as a nation and what we are as a people. And I feel proud. I really feel proud about it as well. And Dr. Bari, you want to say something?
I was just telling we are a very strange nation. So during normal days, we are a scattered nation. But when there are crises, we are one nation. So be it 2005 earthquake or 2010 and 2011 floods, and now the pandemic situation. So I don't think so any one person could have died because of hunger. So we could, every day we are getting people helping us out, and the opportunities which we have created during this period, the self-reliance is important because we will be, inshallah, a different nation. Because I don't think so now we will be importing surgical masks. I don't think so we will be importing surgical gowns. I don't think so we'll be importing PPEs. I don't think so we will be importing face shields. So, and as Anis Saab said, because of the geopolitical situation, we have to have self-reliance, and the government has to realize it. They have to be mindful of this, whether the ruling party or the opposition, they have to think because for the betterment of Pakistan.
Thank you very much. Thank you very much for sharing your views, and thank you very much, Anis Saab. Thank you very much, Mr. Martin. So basically, I think we should now be moving to the questions, because we are receiving a lot of interest from viewers, and I think it would only be fair to also address some of the questions. But just to put a disclaimer, actually, first of all, thanks very much all the viewers for all your interest. I'm looking at a lot of questions coming in, and I'm just thinking, how am I going to cover all of these in the short time that we have here? So thanks very much for this interest, and also and especially to the panelists. I think the topics and the insights that you are sharing, these are so interesting that this would soon be reflected when you would look at some of the questions. While we are putting up the slides of the questions, maybe I would also like to just put one of the questions right away, as in with respect to the research pathways which are currently being pursued in discovering the treatment of COVID-19. We talked about some of the global initiatives, but it would be great if you could also share something with respect to Pakistan, as in what we are doing in order to discover the treatment. So maybe Dr. Bari, if you could take that one, please.
There has been basically since the COVID-19 this coronavirus has been a new virus. It is from the family of a corona, but the behavior it has, it was highly contagious. So people knew nothing about it. So we have been learning since from the beginning, as I was reading somewhere, that those who contacted COVID in early days were at basically they were and those people who are now contacting in the month of June or July, they are at benefit now because initially there was no treatment, but there is some treatment. But for antiviral, only remdesivir is showing some promise, but no
Right.
cure has been yet cured. But we have been, as a nation, we are in the whole universities of Pakistan and different hospitals of Pakistan are collaborating with internationally, being in multi-center trials for because the whole world is or wants to have treatment. We all want to have treatment. So we are working towards that. But I think so. Doing some basic research in Pakistan, we're nowhere there.
Right. Thank you very much, Dr. Bari. That's very impressive, actually, and very also at the same time satisfying to know. So thank you very much for sharing that. Moving on with the questions, I'm sure you are all able to see the slide. The first question, rather, the third question that we have. So what are trends that you are seeing in pharmaceutical industry in Pakistan after COVID-19? And I would invite, maybe Anis to comment on that if you would like, please. Thank you.
So, Ziad, I think the major thing, major shift that I see now is more and more use of digital landscape. So what we have been seeing in the past, this face-to-face detailing, or when it comes to even going and meeting the doctors. So I think, Martin, there's clearly an opportunity for you also. What we see both from patient's perspective, also from industry perspective. So digital and this multi-channel engagement is going to play a major role moving forward. Also, in terms of the trends, even nations, and Bari Saab has rightly mentioned, will be forced to really reconsider their approach towards their sourcing. Like our reliance is mainly on other countries. But if this thing continues, will we remain in a sustainable situation or not? And what we should be doing as a nation. So I think these would be the major element which are going to change the dynamics. Again, from the role of pharmacists, role of doctors, even role of industry is going to change. Even I would say not only for pharma industry, but for other industries also. At one point in time, we thought that working from home was like never allowed even for a day in the week. But what we see now, it's been working very, very well. So all those virtual things are working quite effectively. So this will also become a new normal moving forward, in my view.
Thank you, Anis. Thank you very much. So we can move on to the next question because this was, I believe, already addressed. Right, thank you. And I believe this would be to Martin. So telemedicine and its scope in developing countries.
Okay, and what are the doctors' concern? Which is also an interesting second question there. Okay, good. So the scope for telemedicine is huge worldwide in developing countries or in developed countries. Very much like Anis was saying, the trend is going digital, working from home. Also, I would like to add that also ordering medicine from home and then having it delivered is another trend in the pharmaceutical industry. And then if you're already sitting at home, why still bother and go out unless you really, your teledoctor has recommended it and saying, look, you need to see somebody physical who touches your stomach because it's hard and I can't do that. So there's a tremendous scope, and I think particularly in countries like Pakistan where distances are large, where you have secluded areas, where people have to travel 5 hours, 6 hours to reach the nearest health post. I mean, especially in those places, telemedicine is of extreme value. What are the doctors' concerns? So if we talk to the doctors, believe it or not, they are also almost asking similar questions as patients, saying, how can I treat my patient when I don't see him physically? And then typically we say, well, just try it and and maybe it's good to get to know the customer. And very often customers also call you as a second opinion. So they share their report and they've already seen a physical doctor. So you'll see how it goes for you, and there's little risk. So that takes care of this concern. Then they ask about their flexibility. Can I set my own price? Yes, of course, they can do that. Can I set my own schedule? Very much so. You can work on a Sunday if you like. You can work during Eid al-Adha if you prefer, or you don't. So and that is also what they ask. And I think the most critical one for us is they ask, do you bring me more patients? So are you a referral company? Do you promote my profile? Do you make sure that then, next to the physical patients that I see, I can get an additional set of patients who are paying upfront, digitally, of course, for me. So this is also what they're asking. So that's doctors' concern. And then usually after some time, after having some experience, it goes away.
Right. So can imagine, of course, and there's of course, a curve which has to be accomplished over there. So another question, Martin. So is that there is still a large population who do not have access to smartphones or not very well versed in apps, and how do you intend to tap that market? So this was exactly around the topic that we were discussing when we talked about why Pakistan. So that perhaps reflects a little bit, and maybe you can tell us more about it. Of course, we fully understand in terms of the population and the clear advantages that Pakistan has, of course, in terms of businesses, in terms of the investments, but certainly with respect to specifically with respect to the access to digital channels.
Okay, good. Yeah, it's a good question. I hear this very often. And actually, the experience we have had is surprisingly positive. The first thing is that, yes, many people don't have smartphones, but 1 or 2 people in the family do have. So usually the younger ones, male ones, this is 90% of our registrants are male, but 50% of the people we actually talk to then are the wife, the husband, the wife, the daughter. So a smartphone is always somewhere in reach. We have rather more difficulties with connectivity, that there is no connectivity. And then with some time, people figure out, where do I have to stand? Where's the best connectivity in the house or in the village? So they also figure out that part. So I don't see this as big of a problem as it might have been 2 or 3 years ago. And still, what we are doing is to try innovative things to bridge still the gap which is there, although it's not as big as it might seem. So we were, for example, working with lady health workers in Islamabad together with the Digital Pakistan Foundation and the district health office in Islamabad, and we were training over 300 lady health workers. So the lady health workers, they go around and they visit beneficiaries, and they basically have the doctor with them in their pocket. And when they visit and talk to patients, and very often this is COVID patients as well, then the doctor comes on board. So you don't have to own a smartphone yourself. If your family doesn't own it, maybe the lady health worker can own it. And another thing that we are doing is we also give this access and an e-kiosk model to pharmacies. So the pharmacist can say, if you want to talk to a doctor, and we have pharmacies in Balochistan who do that, look, sit here, talk to the doctor over my phone, the pharmacist's phone, you pay me a little fee, that's an income, and when there's a prescription, I fulfill it. So that is another way how to get around this smartphone issue. So I think it's much more manageable than I thought it would have been myself 2 years ago.
Great, thanks for the insights and the reflections on that. So next question, Anisa, what are the 3 major lessons learned? And this is again regarding the supply chain that we were talking about. So quite an interest there.
Yeah. So I think pandemic is something that you can really never forecast or never control yourself, and there are a lot of areas which are not in your control, and supply chain is one of it. So I would not link it with the pandemic, but what I think what remains important again for chartered accountants to really play their role when they do the business partnering is to focus on the forecasting part of it, how realistic your forecasting is, how you're looking at the numbers, and how your supply chain is geared up to that. And how do you really look at your assumptions every month, that what you had assumed earlier, is it working out well or not? So I link it more with the fundamentals for accountants, and especially the major element would be the forecasting. and how do you really work on that element of forecasting in terms of your processes within your organization?
Right. Great insights. So thank you. And this, we have now the next question. So after experiencing from coronavirus, medical workers are, and so after experiencing from coronavirus, medical workers are feared and preferring to switch to other professional as they feel unsecured and working environment is not supportive due to negligence of healthcare. How could you motivate them to retain in this noble profession and create public trust? I think Dr. Bari, you are, if you could take that one.
I don't agree with this. Basically, medical doctors are who are practicing now. They're not switching. Basically, whoever have before starting practice, they have switched, going into the basically bureaucracy and the other professions. But it is basically you have to lead by front. You have to be a role model. And when we are there in the front, you have been seeing, I've been working on every aspect. So they see your leaders, if they are there on the ground and you keep them motivated. So that's the way you can keep them. I think so. If a total protective environment is being provided in the hospital is the most safest place to be there in the COVID patient, much safer than the community where we don't know where the virus is. So I think so. We have to provide the facilities, the people protective equipments and all these things. That I don't think so. I will not see. And it also basically boils down where you have been, where you graduated from. Your I think so. What we lack in our curriculum is ethics and passion. It should be included in that.
Right, great thought. So if there is passion and of course the motivation certainly, and perhaps, you know, what I have also seen, because I mean, maybe a personal thing, but my mother is also a doctor, and you know, I see an increased passion to serve in these times when you know the healthcare professionals are much needed, and so this is why, and this is one great reason why, you know, there's a lot of course, why we highly value them, highly value the support, and especially during these times when they are risking their own, you know, the lives to take care of others. So a very noble profession, and I think thanks very much for Dr. Bari for sharing your views as well. Now that, of course, you can see by the number of slides that we have a lot of questions. Unfortunately, we are short on time. There are just 8 minutes to go when we have to close. And so the poll results are also now shared on the screen, so everybody can see that. Everybody can see those. So Martin, your specific question is also addressed. Is it already visible to you?
Yes, very much so. I see that 75% of the voters, that is 120 people, said no, their organization is not yet considering, but I hope that today's event has changed this. So I'm expecting 120 inquiries tomorrow.
Yeah, yeah. So the results can certainly continue to be shared and people can continue looking at it. But this actually brings us towards the end of our webinar today. And what an interesting discussion this was. Thank you very much for all the views. Thank you very much for such interesting questions as well. And I believe, you know, overall, it has really, I mean, at least for me, this was quite an insightful session. Plus, it certainly is leaving me more learned and more educated about the entire situation that we have, and also some of the dynamics that we should be looking at. Before I move on to, or I invite Mr. Khalid Rahman to share his views or closing remarks and, you know, the vote of thanks, I would just like to quickly sum up that, you know, basically the current challenges that are faced by our healthcare system due to COVID-19. So that is That is what we addressed. Then, of course, at the same time, we heard about the role of the stakeholders, challenges being faced by the pharma industry, challenges in healthcare delivery systems, which is perhaps one of the very, very important things in these times. And then role of the telehealth, and most importantly, the opportunities. So I would like to close with just one statement that, whatever the circumstances are, we should always be looking for the opportunities, because that is exactly what will always keep us moving. And I would also like to share my own one personal belief. I mean, of course, a quotation which I truly believe in, that everything is possible if you just believe. Impossible might just take a little longer. So whatever the situation, I think we as a nation, and as of course now the entire world, we should continue to challenge ourselves. So and that would give us impressive results, hopefully. So with that, from my side, thank you very much. I would like to wish all of you best of health. Please stay safe, and please take care about yourselves. Thank you very much for all the participation today. It was very interesting for me, and quite a great session. So Mr. Khalid Rahman, if I may invite you, please, to share the closing remarks and the word of thanks. Thank you very much.
Thank you very much, Ziad. A very impressive hosting and moderation. My heartiest congratulations to you. I sent you a message also, but I thought that I will announce that in public. So thank you very much. Assalamu alaikum, ladies and gentlemen. A very good evening, and thank you for joining us today. This was our 6th webinar in the COVID serial, being hosted by the Professional Accountants in Business Committee of ICAP, in collaboration with the North and Southern Regional Committees. Our previous webinars have been on Pakistan economy, business transformation, leadership perspective on organizational resilience, surviving the crisis in oil and gas sector, coping during stress in pandemic, and today we had a very interesting debate on healthcare and pharmaceutical. The main reason for selecting today's webinar was to show our gratitude and admiration to this very important industry, and to our leaders who are serving us day and night during this pandemic. I'm aware of Dr. Bari. You know what a dedicated person he is. A lot of admiration for him, and you'll be surprised the amount of time and effort that he makes in order to not only run his own hospital, which he founded himself together with his other with his other doctor colleagues, but he's engaged in anything and everything relating to health. So Dr. Bari, you are really an icon, and we are very proud of you, and thank you for being with us today. My special thanks to Anis. Anis, on one call, you were available. I'm ever so grateful to you. You were a great, you put in a great debate. You gave us a lot of knowledge on the pharma industry. And I hope your problems with the help of Dr. Bari are resolved in terms of your prices. And Martin, telehealth is a new area for all of us. And I'm sure that we'll be all moving into telehealth. And it was nice that you were responding to the questions online and sharing information with the participants. So your contribution was immense, and thank you very much for being with us today. We are extremely grateful and honored that you, having so much passion for Pakistan and for telehealth and giving good health to people of Pakistan. And also, I believe you have a great passion for Pakistani food. So I'm sure you're enjoying that simultaneously and keeping good health by eating all that food also. Now, coming to our moderator, Ziad. Ziad, really, I mean, very impressive. And I saw you enjoying the whole event. And so I think that was the best part, that highly relaxed, and you were able to communicate and ask the right questions, and you really prepared yourself well. So my heartiest congratulations to you, and we hope to seeing you on our other panel discussions as well going forward. So thank you very much. I've already thanked Dr. Shagufta, who is again one of our proud women chartered accountant. And we all very honored that she has reached that position. And we hope we wish her all success going forward. The contribution from each of the panelists was remarkable. The learning that we did about the dynamics of the pharma industry, the challenges of running a private and public hospital, and basically what is coming new in terms of telehealth was great information, and will only help us all and our members to be able to look at this industry in a wider perspective. And not only that, also to be able to give and appreciate what this industry is doing for the people of this nation. Um, so my deepest gratitude and a big thank you to each one of you all on behalf of ICAP and the Professional Accountants and Business Committee. To bring this webinar, there's a lot of effort that goes behind it, and we had a very dedicated team of volunteers from the PIB committee and from the regional committees, duly supported by ICAP staff who was organizing these webinars. The main organizer of today's webinar were Mr. Khalid Noor. Khalid, thank you very much. You helped us a lot in bringing this webinar to fruition. And Rauf Jan was backing you up and helping you and administratively. So thank you, Rauf, also for a great job done. They were ably supported by Fuad Aftab, Sayyid Muhyiddin, Amir Shaukat Hussain, Asad Feroz, Anwar, Imran Hafiz, Adnan Usmani, Arsanan Rabbani, and Shanawaz Abro. I'm thankful to each one of them for the time and effort for making this webinar serial a success. Now, we are very proud of our members in the PIB committee because they are all working full time, but simultaneously they give a lot of time and effort to develop the professional accountants business. And all this is voluntary work that we all do, work overtime, meet every day to be able to discuss, decide. So a great job which is being done by the committee. Now, we have a large membership which is in in business, and therefore this committee was constituted. And we have a number of events that we hold annually and publications. We issue publications to be able to educate our members and also non-members if they want to. This information is all on ICAP website. We have been publishing post-webinar papers after each webinar. These publications are also available on PAIB committee website. We will also be publishing a paper for this webinar, and we request our panelists to respond a few questions which could not be answered during the webinar due to paucity of time. So for the benefit of our viewers, the number of questions, as Ziad has said, were put up. We could not really bring those questions to you. So we will be writing to you with the questions, and we request you for your response as your earliest convenience so that it could be included in the paper that we'll be publishing. We will continue to hold webinars every fortnightly, and we look forward to your participation. Lastly, I would like to thank President ICAP, Khalilullah Sheikh, and our other council members for the guidance and support in holding of these webinars. May Allah bless you all and keep you safe and healthy. Allah Hafiz, Pakistan Zindabad, Pakistan Payindabad. Thank you very much.